Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. I want to thank Evan Smith from Discover Newport for joining us earlier today, talking about the threats and the challenges that the tourism industry is having on Aquidneck Island, and their hopes of that this crisis of health will begin to wane and they'll have an opportunity to restart their economy down there, an economy that's critically important for all of Rhode Island. Now let's jump over to Dr. Michael Fine. Dr. Michael Fine, thanks so much for joining us.
Good to be here. Good afternoon.
Listen, you've spent some time this weekend crunching some numbers. I want to jump right into it. This has been a wildly underreported issue. The town of Central Falls, the city of Central Falls, is just getting hit hard, a level that I don't know that anybody has really paid attention to. Walk us through what you found.
Well, we're paying a lot of attention to it in Central Falls.
Right.
That said, the case incident rate, the number of tested positives per capita in Central Falls is now greater than the case incidence rate in New York City. In Central Falls, where about 2.6% of the population is positive. In New York City, it's 1.1%. Now, some of that likely has to do with the fact we're doing more testing on the one hand, but on the other hand, getting the widespread access to testing in Central Falls is improving, but it is a very slow process. So I can't tell you that in Central Falls, we are testing more than people are being tested in New York City or not, because no one is reporting the number of people who are tested city by city. We don't have great city by city data, so I can't make that adjustment. I can do it for New York, but I can't do it for Central Falls. And that's also true of, we don't have city by city data for hospitalizations. We don't have city by city data for deaths. We hear about deaths in houses in Central Falls, people dying at home, and that drives me crazy and tells me that we've just got to do a better job. We've got an issue in this little city, and we have similar issues, but not quite as intense in Pawtucket and in Providence.
More than 500 Central Falls residents have tested positive. There's only a little more than 19,000 people that live in the city 1 mile by 1 mile. This is profoundly different than what the rest of the state is suffering through, correct?
Well, it's profoundly different from the rural and suburban places. It's not, I mean, it's different from Providence and Pawtucket, but it is not completely different. You know, when you begin to understand the dynamics of these cities, it's these densely populated areas. And Central Falls is mostly densely populated, whereas Pawtucket has a couple of densely populated neighborhoods and a couple of neighborhoods that are not so densely populated. The same thing is true of Providence. You know, in South and West Providence, lots of dense packed population, but there are the big swaths around PC and Rick, and on the east side that are not so densely populated. So they kind of balance the numbers out a little bit. But that's where the more granular we can get data, the better we can focus on getting the support we need to help stop the transmission of this disease.
To give some comparison, Warwick, which is more than 3 times larger than Central Falls, has about half as many cases as Central Falls, just to put it in some level of perspective.
Right. And as I said last week, in the beginning, the first couple of weeks, Barrington and Central Falls had the same number. I don't think Barrington has got past 40, whereas Central Falls is over 500. Say about the same population size. Barrington is 2,000 or 3,000 less in population, but that's all.
Let's go to the other numbers. Let's go to the more global, statewide, U.S. numbers. Tell us what you're seeing and what the numbers tell us about how long we'll be stuck in this suspended animation.
So first, 1.165 million people have recovered around the world. That's a good thing. But 3.5, almost 3.6 million people are now tested positive around the world, that grew by 140,000 people overnight. And we see a robust growth around the world. And I keep saying over and over again, I am really worried about Bangladesh, and about, other parts of Asia and Africa and South America that are even more densely populated than Central Falls. I think we're going to see a quickly climbing number of deaths in those places. And so while we now see about 250,000 deaths, I can't imagine that this is going to be over. That we're going to get away with less than a couple of million deaths from around the world. In the United States, we are 1.191 million cases, and growing still at 49,000 cases a day, even over the weekend. We are unfortunately up to 68,000 deaths, growing at 2,500 deaths a day. This thing is happening, and it's robust, and it's widespread, and it does not appear to be substantially slowing down. The good news, I suppose, is that it's not growing exponentially, at least in the United States, but it's at this high plateau that doesn't have any sign of decreasing. In Rhode Island, we've seen over the weekend an increased number of deaths, very tragically. 24 Sunday night, or Saturday to Sunday, 21 Sunday to today. We're now at 9,600 cases. We will likely cross the 10,000 mark in the next day or two. The good news is, for the last couple of days, we saw a smaller number of tested positives. However, the testing sites that are testing Pawtucket, Central Falls, and Providence are basically closed on Saturday or Sunday. So the places where we're going to be getting most of the tested positives are closed. And some of those are closed again today because it's a holiday for community health centers. It's, I think, Rhode Island Independence Day. So, we can expect our tested numbers to be lower, but that doesn't mean that the disease is any less active. Thankfully, the hospitalizations are growing, but slowly. The ICU use is growing, but slowly. But again, the deaths are up. I would expect that we would see this level of deaths daily for at least a couple of weeks, until we see our tested positive numbers drop markedly. I hate that.
Yeah.
But I don't see that we have slowed this thing down in terms of disease transmission very much. Remember that we exist at a level of disease activity in proportion to the extent that we're social distancing. And as we lose social distancing, we will see disease activity rise.
A couple of things. We saw number of deaths in Massachusetts and in Rhode Island of very substantial numbers. There seems to be no let up on there. They continue to be older Rhode Islanders, primarily tied to the nursing homes. We seem to just have no ability to stem that. They've created a second specialty nursing home. This one up in Woonsocket at Oak Grove. Don't hold me to the name, Oak Grove. Again, another facility that's had its problems with enforcement issues with the feds. We seem to be taking on the same strategy with the same results without much improvement. Is there anything to believe that we're doing anything different and that we're going to get a different result?
I fear not. I don't see that different approach that focuses much more intensely on preventing disease spread. And, we are seeing deaths in the older population in nursing homes, but we are actually beginning to we've seen deaths in homes of younger people in Central Falls and Pawtucket, and that's really troubling.
Age range of those passing in Central Falls?
40s to 50s, maybe low 60s, but not 70s, 80s, and 90s. People who are, tested positive, doing what they're supposed to do, staying in isolation, and we're not getting them in time when they start getting sicker. So, we are rolling up our sleeves. We've taken an all hands on deck approach, and we are really working hard to reach out to every single household in these two communities.
This weekend was spectacularly nice weather. Most of the week looks to be spectacularly nice weather. There were tons of photos and police reports. Very little enforcement other than going over and asking people to break up. Are we now going to lose whatever success we were having in social distancing, and are we on the precipice of falling into behavior that's going to drive the number of cases up and thus drive the number of deaths up?
I don't have a scientific answer to that. We know social distancing in general helps. I can't tell you scientifically that, social distancing in beaches and parks makes a difference one way or the other. It to me seems a little strange that we are letting people work in factories where everybody's sick, but trying to restrict people from being outside where we don't have good science, one way or the other. So, I don't know if that kind of social distancing is going to change things. I just keep hearing from, I'm talking to people who are sick on the phone every day, and I keep hearing these stories of people. I'm going to work every day. I'm a fork truck driver, or I work on an assembly line, and everybody around me is sick. And those are the people who are calling in because they're sick.
Right.
This seems, to me, that's the major route of transmission, not necessarily beaches and parks. But again, I don't have science to back me up on that.
One of the data companies that tracks social distancing via technology, Unicast, continues to downgrade Rhode Island's social distancing grade because of more movement, because of more interaction, and they see the crossover of data interacting with each other. That does have some math and science to it, and Rhode Island went from an A-, I think we're now D-. Some counties in Rhode Island are at F level, and that preceded this past weekend's spectacularly good weather. Any thought of strategy that the state can implement to try and, the knock it off catchphrase seems to work well with more affluent Rhode Islanders who are most likely to comply as it is, but seems to have zero effect and potentially a negative effect on others who seem less interested in the governor being the sole messenger.
Yeah, I think it's worth looking at Sweden again. And we have demonstrated now, I think, that we have ICU capacity and that we have the ventilators we need. I think it's worth working hard to help people who are got multiple medical problems, people who are over 60 or 65, anybody at risk, working hard to get those people to stay home and maybe let everybody else begin to. Because I just don't see us restricting this population forever and ever. We've done great, we've really done fantastically. If you look at the number of deaths among non-nursing home people, that's been a huge success, and we should celebrate it. But I think maybe it's time to think about, moving to the Swedish model, because we've demonstrated we have the capacity, and then really work hard on making sure that everybody who has to stay in, gets to stay in and stay in with a little support. I had the notion that, maybe we ought to have Christmas carolers, people who sing place to place and sing outside people's houses. So, sort of get people involved in helping entertain the people who have to stay home, make it a big community event. Like get Big Nazo walking around.
Yeah, right.
And taking that to the people, of the houses, the houses of people who we don't want to move around. But to do that, we need to get to a different level of granularity about the population. We need to know everybody, who's where in what house and what they need. And I don't think we're close to that.
Last word goes to you, sir.
In thinking about over the weekend, I think we should be proud of what we've done so far in Rhode Island, but incredibly disappointed about what we've been able to do together as a nation. I have not seen the WPA. I have not seen the Marshall Plan. I've not seen us stand up and really, go after this disease in an organized and concerted way. We're turning it over to the same companies and corporations that have got us into this mess to begin with. And we need to take a real hard look at who we are, at what we are, at what we've done, and what we can and should do together. If we don't change now, we're never going to change. And let me tell you, this one's bad, but it's not the big one. This is the warning. And it gives us the opportunity to prepare for the big one. And to do that, we have to repair the rifts in our social fabric.
Dr. Michael Fine, serious words from you today on Monday. For everyone else, governor's briefing has been moved to 3 o'clock. Again, she does not allow journalists to ask direct phone calls, questions for the public to hear, or follow-up questions. Those are barred from public listening. For everybody else, thanks so much for tuning in. We'll have a number of updates on the site this afternoon. Please stay well, stay safe, and enjoy the sunshine and get some vitamin D. Thanks everybody for tuning in.
Thanks, Josh.